This is All India Radio. Good afternoon. I am Anuja Kumar and with me is Anita Anand with the Midday News. The headlines. Home Ministry directs states to implement lockdown guidelines in letter and spirit to ensure smooth movement of inter- and intra-state cargo. Government to focus on strengthening infrastructure and surveillance as part of strategy to manage COVID-19 positive cases. 44 evacuees brought back from Iran returned to their homes after successful completion of quarantine period. ICMR scales up its COVID-19 testing facilities. President, Vice President and Prime Minister greet people on the occasion of Baisakhi. The Home Ministry has directed states to implement lockdown guidelines in letter and spirit to ensure smooth movement of inter- and intra-state cargo, trucks, workers and functioning of warehouse and cold storages. The Ministry had issued consolidated guidelines on lockdown measures to be taken by all central ministries and departments in the states and union territories for containment of COVID-19. Clarifications to these guidelines were also issued to ensure availability of essential goods and services across the country and prevent hardships to the people. The Ministry said the guidelines and clarifications are not being implemented in letter and spirit in some parts of the country. In a communication to the Chief Secretaries of all states and union territories, it said vehicles carrying essential and non-essential items were being detained by police that could lead to potential shortage of commodities. The Home Ministry said interstate and intra-state movement of all trucks and other goods vehicles with one driver and one additional person is allowed as long as the driver is carrying a valid driver's license. Empty trucks and goods carriers should also be allowed to operate while on way to pick up goods or returning after completing a delivery. Local authorities should actively facilitate the movement of truck drivers and cleaners from their place of residence to the location of their trucks. The vehicles carrying essential goods should not be detained as it could lead to shortage of these goods. The Union Government is well prepared to tackle the possible exponential rise in COVID-19 cases. The Government is focusing on strengthening infrastructure and surveillance as part of strategy to manage COVID-19 positive cases. Briefing media in New Delhi yesterday, the Health Ministry official said that, based on the discussions at the level of Health Minister and Home Minister, work is on urgent basis to expand capacity for COVID-19 testing in government and private medical colleges across the country. Listing out several measures, he also said the centre is well prepared to deal with the situation and 1,05,000 beds are ready in the dedicated 601 COVID hospitals.
देश हर तरीके से इस पर्टिकुलर महामारी से लड़ने के लिए तैयार है। जैसे जैसे सिचुएशन इमर्ज होगी उसको एंटीसिपेट करते हुए उसके लिए भी एक्स्ट्रा प्रिपेयर्डनेस की तरफ देश के एफर्ट्स रहे हैं और उसके साथ हम लोग मिलकर लड़ाई लड़ रहे हैं। इस लड़ाई को सरकार के साथ प्राइवेट सेक्टर सब हम मिलकर लड़ाई लड़ रहे हैं और उसमें सबसे मुख्य अंग है हमारा सपोर्ट जो कि हमारे कॉमन सिटीजन जो आज हमारे साथ खड़ा होकर इस लड़ाई को लड़ रहा है और हम मिलकर इस देश की तरफ से पूरी दुनिया को एक अच्छी एग्जाम्पल दिखाएं कि जब पूरा दुनिया इस बीमारी से जूझ रही थी तो इंडिया ने एक सक्सेसफुल एग्जाम्पल दुनिया के सामने प्रस्तुत की।
The Home Ministry official said the situation regarding essential commodities is under control. In the Home Ministry control room, officials of Ministries of Civil Aviation, Consumer Affairs and Railways have been working in coordination with states to resolve logistics problems. States and UTs have again been informed that there is no restriction on interstate and intra-state cargo transportation and they must ensure passes for employees of manufacturing units of essential commodities.
गृह मंत्रालय ने स्टेट्स और यूटीज को फिर से स्पष्टीकरण दिया है कि इंटरस्टेट एवं इंट्रास्टेट कार्गो की आवाजाही पर कोई भी रोक नहीं है, चाहे आवश्यक वस्तु या उसके अलावा कोई भी वस्तु ट्रांसपोर्ट हो रहा हो।
A representative of Indian Council of Medical Research informed that over 1.86 lakh samples have been tested so far, of which 7,953 have been found positive for COVID-19. He said in the last 5 days, on average, 15,747 samples were tested per day and 584 of those were found positive per day. On a question regarding vaccine for COVID-19, it was told that over 40 vaccines are under development, but none have reached the next stage, and as of now, there is no vaccine. The number of COVID-19 cases in the country has gone up to 9,152, while the death toll rose to 308. The Health Ministry data said the number of active COVID-19 cases stood at 7,987. As many as 856 people have been cured or discharged, and one had migrated. Maharashtra has the highest number of 1,985 cases, followed by Delhi with 1,154 and Tamil Nadu 1,043. The death toll is highest in Maharashtra with a loss of 149 lives. Madhya Pradesh has reported 36 deaths, followed by Gujarat 25 and Delhi 24.
Government is working to ensure that affordable medicines are available at 6,300 Pradhan Mantri Jan Aushadhi Kendras across the country. Minister of State for Chemicals and Fertilizers, Mansukh Mandviya, has said that warehouses of Jan Aushadhi centers are working day and night on war footing to deal with the current situation due to COVID-19. During the lockdown, pharmacists of Kendras are delivering quality generic medicines at affordable prices to the common citizens. The mobile application Jan Aushadhi Sugam is also available for common public to locate their nearest Jan Aushadhi Kendra and availability of medicines with its price. Union Health Minister Dr. Harshvardhan has exhorted scientists to develop COVID-19 medication solutions, keeping a fixed time frame in mind, saying these are times of war and it should not be treated as a routine research project. He held a review meeting with the Director General of Council for Scientific and Industrial Research, Sheikh Harbante, and all the 38 CSIR lab directors. During the meeting, Mr. Mande said a core strategy group, CSG, has been set up and 5 verticals have been identified under which coronavirus-related activities are being carried out.
Information and Broadcasting Minister Prakash Javadekar today said that media persons should also take care and follow all precautions amidst the COVID-19 pandemic. Speaking to media, Mr. Javadekar said media persons are also frontline workers like doctors, nurses, police personnel and sanitation workers.
कोविड महामारी के खिलाफ देश लड़ रहा है और प्रधानमंत्री जी के नेतृत्व में उसमें हम विजयी होंगे। इसमें जैसे डॉक्टर, नर्सेस, सफाई कर्मचारी, पुलिस कर्मचारी, सरकारी कर्मचारी, बैंक के कर्मचारी, वैसे ही मीडिया के कर्मी जो है वो भी एक तरह से फ्रंट लाइन काम करते हैं, क्योंकि लोगों तक खबर पहुंचाना उनका काम है, उसके लिए जगह जगह जाते हैं।
Union Minister of Consumer Affairs, Food and Public Distribution, Ram Vilas Paswan, said the government will deal strictly with black marketeers and hoarders. In an exclusive interview to DD News, Mr. Paswan said that more than 30 lakh metric tons of food grains have been sent to states and union territories. He also said that during the lockdown announced to contain COVID-19, instructions have also been given to states to ensure food supply to all, including people without ration cards.
मजदूर ऐसे हैं जिनका राशन कार्ड घर पर है, वो कि यहाँ फंसे हुए हैं, तो इसलिए ऐसे लोगों के लिए 2 व्यवस्था है। एक तो है कि उनको हमने कहा कि स्टेट डिजास्टर फंड या नेशनल डिजास्टर फंड के माध्यम से फ्री में उनको खाना दिया जाए, और दूसरा है कि राज्य सरकार जो है जितना भी अनाज चाहे वो अनाज उठा करके 21 रुपए किलो गेहूं, 22 रुपए किलो चावल लेकर के उनको डिस्ट्रीब्यूट कर सकती है।
44 evacuees returned to their homes from the Indian Navy quarantine facility situated in Mumbai after successfully completing 30 days in the centre. These 44 evacuees, including 24 women, have been brought back from Iran. They were airlifted to Srinagar yesterday by Indian Air Force aircraft. A dedicated team of medical staff from the Navy worked tirelessly to monitor the health of the evacuees. Indian Navy said it is committed to assist the national effort in the fight against COVID-19.
Information and Broadcasting Minister Prakash Javadekar today said that wearing mask is desirable. In a tweet today, Mr. Javadekar said, Masks can be prepared in 2 minutes by anyone. He said he has made it and other people can also do it. He shared a video wherein he was seen making a mask. In the wake of COVID-19 pandemic, Khadi and Village Industries Commission, KVIC, has successfully developed a double-layered Khadi mask and has procured orders for supplying it in large quantities. Talking to AIR News, KVIC chairman VK Saxena said the commission is specifically using double-twisted Khadi fabric for manufacturing of these masks, as it helps retain 70% of the moisture content inside, while providing an easy passage for the air to pass through. Mr. Saxena added that these masks are special because they are made of hand-spun and woven khadi fabric, which is breathable, can easily be reused, washable and biodegradable.
खादी कमीशन ने जो है डबल लेयर्ड मास्क तैयार किया है और उसके जो सबसे बड़े फायदे हैं वो ये हैं कि वो वॉशेबल है, पॉकेट फ्रेंडली है और उसके साथ साथ बायोडिग्रेडेबल है, जिसकी वजह से इस मास्क की इम्पोर्टेंस बढ़ जाती है। प्योर कॉटन फैब्रिक यूज किया गया है और इसमें डीटी फैब्रिक मतलब डबल ट्विस्टेड फैब्रिक को यूज किया है, जिससे कि एब्जॉर्प्शन है वो 70% बढ़ जाता है।
Mr. Saxena informed that the KVIC has recently bagged an order to supply 7.5 lakh pieces of khadi masks to Jammu and Kashmir government alone, in which 5 lakh masks will be supplied to Jammu district, 1,40,000 to Pulwama, 1 lakh to Udhampur and 10,000 to Kupwara district. He said the khadi stitching center at Nagarota near Jammu has been turned into a mask stitching center, which is producing 10,000 masks per day.
जम्मू के पास एक जगह है नगरोटा, जहां पर खादी कमीशन का एक रुमाल स्टिचिंग सेंटर है जो 3 साल से चल रहा है। उस सेंटर को पूरा का पूरा जो है मास्क बनाने में कन्वर्ट कर दिया गया है, जहां करीब 10,000 मास्क पर डे जो है बन रहे हैं।
Our correspondent reports in 1 meter khadi fabric, 10 double-layered masks are being made by the KVIC. In order to make 7.5 lakh masks, around 75,000 meters of khadi fabric will be used, which will further enhance livelihood opportunities to the khadi artisans.
You're listening to the Midday News on All India Radio. A reminder of the headlines before we move on. Home Ministry directs states to implement lockdown guidelines in letter and spirit to ensure smooth movement of inter- and intra-state cargo. Government to focus on strengthening infrastructure and surveillance as part of strategy to manage COVID-19 positive cases. 44 evacuees brought back from Iran returned to their homes after successful completion of quarantine period. ICMR scales up its COVID-19 testing facilities. President, Vice President and Prime Minister greet people on the occasion of Vaisakhi. For quick news updates round the clock, follow us on Twitter handle at NewsOnAIR Alerts. Kerala has started to flatten the curve of COVID-19 infection as very less number of positive cases are being reported, with more people recovering from the disease over last 1 week. A report.
Kerala is in great relief as from a situation of recording the highest number of COVID-19 cases a month ago, it has reached to reporting just 2 cases and over 36 people recovering in a single day. 194 patients are under treatment for COVID-19 in Kerala presently. Bringing cheer, a total of 179 people had recovered from the disease so far. Meanwhile, the state cabinet meeting held in Thiruvananthapuram today had not decided on lockdown extension and instead decided to wait for the decision from the centre regarding the same. The meeting apprised the present situation and decided to continue with the strict measures and alert even as the state is taking hold of the situation. Authorities had informed that the Vishu celebrations to be minimal and strict actions will be taken against those not following the guidelines. Mayusha for AR News from Thiruvananthapuram.
In Telangana, state government has stepped up measures to contain spread of coronavirus in the state. Yesterday alone, 28 more people tested positive for the virus. With this, the number of total COVID-19 cases has gone up to 531 in the state. More from our correspondent.
Over 27,000 people have been quarantined, including those who have travel history, attended Markaz event in Delhi, besides their family members and primary contacts. So far, 103 persons have recovered from COVID-19, while 16 persons succumbed to the virus, and over 25,000 people have been discharged from quarantine facilities. As the number of cases being reported is going up, the state government is making the lockdown stringent while creating over 200 containment zones across the state. Lakshmi, AIR News, Hyderabad.
In Uttar Pradesh, the prisoners in jails are giving every kind of contribution from their level for the welfare of humanity in this unprecedented crisis period arising out of the corona epidemic. The jail inmates in prisons of the state have made more than 556,000 high-quality masks to overcome the scarcity of masks. They are making sanitizers, preparing PPE kits to protect coronavirus, and hospital clothes are being prepared in jails for patients. The prisoners are continuously working overtime, giving shoulder in this time of crisis. Feeling sense of social responsibility on their own, the prisoners have contributed in the Chief Minister's Disaster Relief Fund. Setting an example of sensitivity and humanity, the prisoners in 5 jails in the state at Ghaziabad, Meerut, Bulandshahr, Muzaffarnagar and Bagpat have contributed 2,33,400 rupees from their earned remuneration. More from our Lucknow correspondent.
Working in prisoners, the prisoners skilled in different fields like agriculture, handicraft, carpenter, blacksmith and others get daily wages. The laborers are divided into 3 types according to their efficiency and merit. Rupees 25 per day is paid to unskilled, 30 per day to semi-skilled and rupees 40 per day to skilled prisoners. The prisoners, taking inspiration from jail personnel who recently contributed their one-day salary into Chief Minister COVID Care Fund, came forward for this voluntary contribution for humanity. MS Yadav, AIR News, Lucknow.
A total of 85 new confirmed cases of novel coronavirus have been reported in Delhi during the last 24 hours, taking the total number of cases to 1,154. Delhi government has confirmed that 28 patients have been cured and 24 deaths have been reported in the national capital. A total of 14,036 tests have been conducted in Delhi so far. Assam police have appealed people of Guwahati and the state not to panic following the arrival of 5 foreign nationals last evening. In a tweet, Additional Director General of Police GP Singh said that 5 people, including 3 French, have reached Guwahati from Manipur after they completed their quarantine period in Manipur. He said that all of them have approval of Ministry of External Affairs to travel from Manipur to Delhi via Siliguri. Our Guwahati correspondent reports that no new case has been reported in Assam during past 3 days. So far, 29 positive cases have been reported in Assam, and one of them lost his life.
In Madhya Pradesh, the total number of infected patients in the state was 564 till last evening. In Indore, 311 people have been infected with the coronavirus. The number of patients in Bhopal is 134 so far. In view of the worsening situation in Indore, Ujjain, Bhopal, 1,200 samples of coronavirus suspects have been sent to Delhi for investigation. All these reports may be received by this evening.
To effectively counter corona outbreak in Madhya Pradesh, the state government has been implementing the IITT, means Identification, Isolation, Testing and Treatment Strategy. Entry and exit from the infected areas has been strictly prohibited to check spread of corona infection. Chief Secretary Iqbal Singh Bains informed that the corona sample collection facility is continuously increasing. 7 labs are already working for coronavirus testing in the state. 14 labs will be operational soon and 20 more will be ready within a short span of time. Health tests of more than 468,000 laborers have been conducted in rural areas of the state so far. These include laborers from outside the state. As many as 18,174 laborers of various states are residing in the state. Food grains and packed food have also been arranged for them. In addition, Ayurvedic, homeopathic and Unani medicines are being distributed them to boost their immune system. Sanjeev Sharma, AIR News, Bhopal.
In Gujarat, the total number of COVID-19 cases rose to 538 with 22 fresh cases reported in the state today. State Health Department said 2 deaths were reported today, each from Ahmedabad and Vadodara, taking the total number of deaths in the state due to the contagion went up to 26. A report from our correspondent.
Principal Secretary of Health Department Dr. Jayanti Ravi said 13 cases were reported from Ahmedabad today, 5 from Surat, 2 from Banaskantha and 1 each from Anand and Vadodara. She said 3 persons were discharged today from hospital after recovery. Out of 33 districts of the state, 20 districts have been affected by COVID-19 so far. The total COVID-19 cases in Ahmedabad have rose to 295 today. Meanwhile, Ahmedabad Municipal Corporation has mandatory for public to wear masks at public places. The order has been implemented from today. Those who violate the order will be slapped with a fine up to 5,000 rupees. Aparna Khut, Air News, Ahmedabad.
The centre is ensuring that affordable medicines are available at Jan Aushadhi centres across the country. Minister of State for Chemicals and Fertilizers Mansukh Mandviya has said that even in the current difficult circumstances, the Pradhan Mantri Jan Aushadhi Kendra people are working as corona warriors and serving the nation. A report.
During the lockdown due to spread of COVID-19, pharmacists of Pradhan Mantri Bharatiya Jan Aushadhi Kendras are delivering quality generic medicines at affordable prices to the common citizens of the country. At present, more than 6,300 such Kendras are functioning across the country, covering 726 districts. Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana is being run by the Department of Pharmaceuticals to provide quality and affordable healthcare to anyone in need. One central warehouse in Gurugram, 2 regional warehouses at Guwahati and Chennai, and around 50 distributors are working with their full capacity. Mobile application Jan Aushadhi Sugam is also available for common public to locate their nearest Jan Aushadhi Kendra and availability of medicines with its price. The app can be downloaded from Google Play Store and iPhone Store. With Bhupendra Singh, Suparna Saikia, AIR News, Delhi.
Several union ministers have resumed work from their offices while taking strict precautions amidst lockdown due to COVID-19. Finance Minister Nirmala Sitharaman, Tourism Minister Prahlad Singh Patel, Sports Minister Kiran Rijiju, Tribal Affairs Minister Arjun Munda were among the several ministers who joined office today.
Chief Election Commissioner Sunil Arora and Election Commissioners Ashok Lavasa and Sushil Chandra will contribute to fight against COVID-19 in the form of voluntary reduction of 30% of their basic salary from Election Commission for 1 year. The Election Commission said that the numerous steps being taken by the government and the civil society organizations require vast resources for which contribution from all sources might be helpful. EC said the mammoth task of controlling the spread of this pandemic and taking various measures to manage and minimize its impact on the public health and the national economy require vast resources.
In our series Experts Speak on All India Radio, we bring you the views of some leading medical experts on COVID-19. Talking to AIR News, Dr. Sanjay Pandey of Govind Ballabh Pant Hospital, Delhi, spoke about the use of masks, saying it is important to wear them while stepping out of home.
The WHO says that person who is having symptoms of coronavirus, they should be wearing masks. There is no doubt about that. But at the same time, people who are getting exposed to this type of population or healthcare workers who are visiting the hotspot area or maybe the area where patients are likely to be more, they should definitely wear the mask. It's important that even if you go outside, it's better to wear the mask.
Dr. Rakesh Garg of AIIMS Delhi said the spread of COVID-19 infection takes place through a person having a travel history as well as from those who have come in contact with the infected person.
COVID-19 is being spread from persons who have a travel history from somebody or a person who is taking care of positive patients and they have not used proper precautions. So those are the things, if they have this positive history, then probably the chances of COVID-19 will be more. As compared to those patients who does not have any contact history with these patients, not history of travel, they are staying there at home, the chance will be much lesser.
Spiritual leader Sri Ravi Shankar also urged people to stay at home and avoid gathering in crowds.
अभी की परिस्थिति ऐसी है, सब अपने अपने घरों में रहो, एकांत में रहो, ज्यादा भीड़ में ना जाओ. ये प्रकृति के द्वारा दिया हुआ एक मौका है आपको अंतर्मुखी होने के लिए. अंतर्मुखी सदा सुखी. हम अपना थोड़ा सा साधना पर हो जाएं, थोड़ी देर बैठ के ध्यान करना शुरू करें, मौन रखें, ये रोग निरोधक शक्तियों को बढ़ाएं. प्राणायाम, ध्यान, योगासन, ये सब करिए घर में बैठे बैठे.
Actress Kriti Sanon appealed to the people to follow lockdown restrictions. She said that stay home and be safe.
Do not touch anything, wear a mask. Do not touch your face. Come back, wash your hands for at least 20 seconds. Sanitize everything that you've touched. अगर आप अपनी लिफ्ट में जा रहे हैं तो लिफ्ट का बटन हाथ से नहीं दबाएं, एल्बो से दबाएं. If you're a righty, use your left hand to open all the doors and turn knobs. Stay positive, stay fit, stay at home.
Carnatic music exponent and playback singer Sudha Raghunathan appealed to the people to install the Arogya Setu app and assist in combating COVID-19.
Once installed on a smartphone through an easy and user-friendly process, the app detects other devices that have the Arogya Setu app via Bluetooth and GPS. The app then calculates the risk of infection based on sophisticated parameters, algorithms, and artificial intelligence to ascertain the risk levels. This app will enable people to assess for themselves if they are at risk of being infected by the COVID-19 virus.
People across the country are following government's appeal to stay in their homes during the lockdown period. To deal with the present situation, people are engaging themselves in different activities like completing their household chores, playing indoor games, reading books, doing gardening and pursuing their hobbies. We spoke to a cross-section of people who shared their views on lockdown and how they are utilizing their time during this period, as well as procuring essential supplies.
I am Priyansh from Delhi. I am currently preparing for joint entrance exam. Due to lockdown, I am taking online classes and clearing doubts with my teachers through WhatsApp. I talk to my friends through video call and play online games to spend my time. I request everyone to stay home. All groceries and essential goods like milk, vegetables are easily available in nearby area. So we have to stay calm and involve ourselves in household chores.
This is Arpita from Patna and I am a student. During this lockdown, I keep engaged myself in studies, cooking and singing. There is no shortage of anything, be it medicines, milk, vegetables or groceries. Stay home, stay strong, stay empowered because our current actions will determine how much we are able to minimize the impact of this disaster, help the needy people. It's time to exercise caution at every step.
World Bank has praised the Arogya Setu app launched by India to curb the COVID-19 pandemic. Citing example of the app, a World Bank report said innovative solutions can greatly help educate and track contagion across the populations at large. South Economic Focus report of the World Bank said that the digital technology can also be used to monitor the spread of COVID-19. It said India recently launched Arogya Setu app that uses location data from persons' smartphones to tell users if they have been near someone who tested positive for COVID-19.
The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion program on COVID-19. Dr. V.K. Paul, member Niti Aayog and chairperson, Empowered Group for Medical Emergency Management Plan to tackle COVID-19, will participate in the discussion. Listeners can ask questions to the experts on toll-free telephone number 1800-115767. You can also ask questions on telephone number 01123314444 and post queries on our Twitter handle @AIR News Alerts by hashtag AskAIR. President Ram Nath Kovind today paid tribute to the freedom fighters who were martyred at Jallianwala Bagh on this day. In his message, the President said their sacrifice can never be forgotten by the nation and their courage and patriotism continues to inspire people. Vice President M. Venkaiah Naidu and Prime Minister Narendra Modi today joined the nation in paying homage to the martyrs on the anniversary of Jallianwala Bagh massacre. In a tweet, Mr. Naidu said, "The gory incident is one of the darkest chapters in India's freedom struggle and a testimony to the innumerable sacrifices made by the freedom fighters and the unimaginable hardships underwent by them in freeing India from the British rule." Mr. Modi said, "The nation will never forget their courage and sacrifice." He said their valor will inspire Indians for years to come. President Ram Nath Kovind has extended his greetings and good wishes to all citizens on the auspicious occasion of Baisakhi, Vishu, Rongali Bihu, Nobabarsha, Baisakhadi, Puthundri, Pirapu, which are being celebrated in different parts of the country. Mr. Kovind said these festivals are a symbol of unity inherent in the cultural diversity of the country. Vice President M. Venkaiah Naidu and Prime Minister Narendra Modi have greeted people on the occasion of Baisakhi today. And now, before we end the bulletin, the headlines once again. Home Ministry directs states to implement lockdown guidelines in letter and spirit to ensure smooth movement of inter- and intra-state cargo. Government to focus on strengthening infrastructure and surveillance as part of strategy to manage COVID-19 positive cases. 44 evacuees brought back from Iran returned to their homes after successful completion of quarantine period. And ICMR scales up its COVID-19 testing facilities. And with that, we end the Midday News.